action and institutional strengthening. The project is designed for holistic.
The basic concept about this is before some interventions by the district, we had a very low family planning uptake. As a result, some implementing partners came in to support the district. One of the implementing partners is ACODEF, and secondly, even the Maristop Uganda. ACODEF is supporting 4 sub-counties, that is Laropi, Dufele, Lefori, and the Moyo Town Council. What they do on the ground is they support the facilities to conduct community outreaches and family planning methods. They also support the village health teams to dispense family planning methods in the community. The methods the VSTs dispense is Sayana Plus, that is injectables. They started supporting the district in 2022, and by that year the family planning uptake was very low, but as the interventions, they have increased the family planning 2023 to 39. They continue with the interventions, and as per now, the uptake has increased from 39 to 49. No, 43. From 39 to 43 as per the end of financial year. That is because of the interventions. They support the VSTs and the facilities.
And why? Sayana is a method that women feel is very easy to accommodate and is very easy to go in for it. No evidence. But these other methods here, like the implant, these people know the sites where we're putting these things. At the end of time, because so male involvement in family planning uptake is still a very big challenge. And that's where the biggest challenge is coming.
We see you performing well in family planning. When it comes to immunization, you're not doing well. Why? So in those outreaches that we are going to, we need to integrate our service so that we should be performing well across all key health indicators. Because integration is actually the way to go. So next time, as we review our performance, especially at the district level, I would expect facilities like Lefori, Dufele, and Laropi, and hospital to excel in all indicators.
How do we sustain the good practices we have been undertaking? We are all aware now family planning is a key issue in Uganda because our population is growing every year, but the resources are not changing. The small piece of land you have remains, but the population keeps growing. 2, we are faced with a number of challenges. We every day get school-going age or school girls getting pregnant. We get abortions taking place. What is it telling us? It tells us that those who are women with unmet need for family planning. The unmet need for family planning is still huge. Therefore, we need to work aggressively to bridge the unmet need for family planning. We are talking about fighting and reducing maternal mortality and perinatal death. But now, how do we reduce this? Family planning is one of the key pillars of safe motherhood. The moment we embrace family planning very well, that means the aspect of maternal mortality and perinatal mortality is automatically taken care of. We have to look at it that it's one of the life-saving commodities that must be considered. And the most important point we have brought here is we need to engage all stakeholders at all fronts. The men should be brought on board. Our opinion, religious and cultural.
And oftentimes, it's good for us to make sure that projects sustain their good things. We have been here sitting, listening to the good stories and how work is progressing. How the difference from the sub-counties we're intervening and those we are not is clearly demonstrating it itself that this project has succeeded. So I have been challenging, I think I spoke with Okelo and then the team. We ought to see what is that we can do slightly differently. It is very boring, and I have never seen a project that a donor approves to do exactly the same thing it did in the first phase. There will be some new dimensions that you must be able to bring. If you find a serious donor, they will ask you many questions. What is that? What worked well? What did not? And what are you going to do to make sure that you introduce new dimensions? And we cannot forge this. It is from these discussions that we have. I value a lot the contribution we have made in this day.
Right now, the challenge we have in this country is in the direction of addressing the quality of citizens we have. That's where we are going. We have tackled the issues of infant mortality rate. We are also addressing our issues of maternal deaths, but then the quality of the citizens, that's where we are going. Are we having citizens who are of that quality, who are productive? We have a challenge of poor people producing poor people. That's the challenge now we have. Poor people producing poor people. The 39% who are purely peasantry. That's the focus government is having right now. How do we get this 39% from poverty to join the money economy? Because as long as they remain peasantry, they are producing peasants. That's the greatest challenge now. Poor people producing poor people. Government is struggling to reduce that gap, but they are increasing, producing more. So it is our greatest challenge as a country. So I would want you to know that when we are dealing with those issues, we are now dealing with the issues of quality. Quality in terms of nutrition, quality in terms of education, quality in terms of housing. That's the challenge now. So I want to really commend you that your efforts are towards offering opportunity to the people.
So, just a brief